Periodontitis, diagnosis and treatment. It's not only a frustration when you're submitting your claim to the insurance company. And even though FCG's claim to fame is about helping you improve your benefits reimbursement rate, I do want to have a discussion about at least spending 2 minutes with your patients, whether it's hygienist or doctor, some clinician, explaining the etiology to periodontitis, why you're making a diagnosis that a patient does have periodontitis, and fully explaining not only the treatment, the consequences of no treatment, but also the maintenance process that follows. And it's important to have that chairside conversation. The reason that I wanted to do this recording today is I had someone very close to me tell me about an 8 millimeter pocket that they had that needed some treatment. And they explained the whole process to me. And what I was hearing was they were uncomfortable to the probe and they thought it was related to the provider, which we know that the inflammatory markers there are making the gingiva and that periodontal pocket much more inflamed and uncomfortable. So even if you have a blunt periodontal probe, you are going to experience pain in an area that's inflamed due to these pathogens. But they were explaining to me how quickly the diagnosis was made, how quickly the treatment recommendation was made, and fixated really on the cost. When I was treating in practice, I explained the etiology of the periodontitis, what was happening, what could happen if we do not treat the periodontitis, and then not only what the treatment looked like, but how we maintain that treatment in the 12 to 16 weeks following. Also, home care was a big part of that discussion, but with a polished discussion in 2 minutes, you can really explain all of this and not rely on the compliance of a patient when they're chairside, because yes, they may seize that opportunity to have it treated because they didn't really understand what was happening. They recognized there was urgency and they felt slightly pressured at the time, just because it seems like it's a big deal and it needs to be done. But they go home and they start to say, I don't have clarity around all of this. And then even though they had the treatment done, they're not going to be compliant in coming in for their periodontal maintenance appointments or compliant with their home care. They're just going to think that something was wrong about that appointment. But if I believe the statistic is 47% of adults have some form of periodontitis, this is not new and novel to you and your patients. And this is a discussion that needs to be ironed out and really polished in your practice so that way patients understand and we prevent irreversible bone loss